look-alike, sound-alike drugs. Coming to the introduction, and as recent era, if you are seeing so many new brands drugs has been introduced, and many of the medications look like similar, and it sound like similar. That is, phonetics it's similar. So mostly it will be confusing the pharmacy people and the nurses and even the doctors. So this similar packaging may lead to potential harmful medication errors. What is look-alike, sound-alike medication? So look-alike, sound-alike medications involve medications that are visually similar in physical appearance or packaging and have spelling similarities or similar phonetics. What are the common risk factors of look-alike, sound-alike medications? The first one is illegible handwriting. So the prescription, for those who are writing the prescription, if they are not writing it legibly, it will be causing an error. And second one is incomplete knowledge of drug names. So whoever is writing the drug name, if they doesn't have the proper knowledge, it will be also causing an error. Then even the newly available products, and the two drugs are looking similar, that is even packaging or labeling, and with the similar strength, dosage forms, frequency of administration, and similar clinical use. What are the strategies to avoid errors with the look-alike, sound-alike medications? The first one is procurement, second storage, third prescribing, fourth dispensing or supply, and fifth administration, sixth monitoring, and seventh information, eighth patient education, and finally evaluation. So let us see one by one. So first let us see what is procurement. So procurement is the minimize the availability of multiple medicine strength, and whenever possible avoid purchase of medications with a similar packaging or appearance, and even the new products are introduced commercially. Always the pharmacist and the staff, we have to compare them with the existing package, whatever we are having in our hand. And second strategy is storage. So storage, here the Torman lettering to emphasize the difference in the medication with the sound-alike medicine. So what is Torman lettering? Torman lettering is nothing but the practice of writing part of the medication's name in the uppercase letters. That is the dissimilar letters we have supposed to write it in the uppercase, that is capital form, to help distinguish sound-alike, look-alike medicines from one another to avoid medication errors. And here you can see that a Tallman lettering, that Humalog and Humulate. So that dissimilar letters LOG and LIN written in an uppercase, that is capital letter. And the second one you can see that picture, that is Novolog, that is the dissimilar letters LOG and LIN differentiated as uppercase, and oxycodone and oxycontin, that is dissimilar letters CODONE and CONTIN written as uppercase letters. And the next, if you are coming down, and you can see that fluoxetine and duloxetine, that is dissimilar letters, that is FLU and DULOX has been written in an uppercase. So subsequently, so we can follow the same things to avoid the look-alike medication errors. So for safe medication practices and Food and Drug Administration, the Joint Commission and other safety conscious organizations have promoted now Tallman lettering to reduce the confusion between similar medication names. And even we can use additional warning labels for look-alike medicines. That is, warning labels should be uniform throughout the respective facility to facilitate identification. So in case if you're having a warning label, that color differentiation like Tallman lettering, whatever you are following in the pharmacy, the same thing should be followed in all the department, like even in operation theater or ICU or CCU ICU or in the ward or wherever you are having the lookalike or sound-alike medicines, the same protocol should be practiced in all the areas and it should be a permanent one. And you can see that how we have stored the medicines, the storage of medications. So these are the warning labels on storage bins. And for sound-alike medications, we can't practice the Tolman lettering. So instead of that, what we can do, we can go for a pharmacological name. So that is mainly trade or a trade name may be added to distinguish between the medications. So that is, it's written mycophenolate, mofetil, that is 250 mg or 500 mg. So the brand name we can write it. So that is for sound-alike medication, Tolman lettering will not be possible. So the non-proprietary name should be in larger font size than the brand names. And here you can see that that is the pharmacological name, that is tetanus immunoglobulin and tetanus toxoid. And even store the lookalike sound-alike medications separately from their list last refer. So avoid whenever possible, avoid storing the products in immediate proximity to one another. So better you can store it in a far away manner. Coming to the prescription of drugs. So the prescription main thing we have to look after, that is write legibly. So here the mainly the drug prescription will be returned by the doctors. So we can make sure and make them to write the prescription in a clear form, whether on an inpatient order or even a prescription. And always the prescription should clearly specify the name of medication, dosage form, dose and complete direction of use, and include that the prescription paper should have the diagnosis of diagnosis or medication indications so that we can differentiate possible choices in the eligible orders. And even whenever possible, the drug names and computerized prescription should incorporate Tolman lettering. So whatever the drugs we have in the storage, we have in the pharmacy, so better we can go for a computerized prescription order entry. And always communicate clearly. So take your time in pronouncing the drug name, and even that is the main error will be occurring at the time of the verbal order. So that if you are in an emergency situation, even if you are in an emergency situation, if you are working as a nurse, MCC or ICU, if doctors giving a verbal order and if you are not understanding the name of the drug properly, don't hesitate to ask them to repeat the drug. So better avoid the medication error. And the fourth one is dispensing and supply. So here, identify medicines based on its name and strength and not by its appearance or location. So sometimes we may be keeping dopamine in the second rack, and that the staff in charge, she may be knowing that the second rack, that is dopamine we may be keeping. But in spite of your absence, another staff might have kept the dopamine instead of dopamine in that second rack. So by looking at the appearance of location, never confuse, and always you have to cross-check the medicines visually, and you should take the drug and you have to visually you should check the label of the medicines, and you should check the appropriateness of dose for the medicines dispensed, and read medication labels carefully at all dispensing stages and perform triangle check. So triangle check is to check actual medicines against the medicines label and against the prescription. So the triangle check is nothing but you have to check the prescription and the request form and the medicine and finally medicine label. the triangle chart. So initially you should check the prescription request form, second medicine, then medicine label. Double checking. So double checking should be conducted during the dispensing and supply process. So if you are supplying the drug to the peripheries, that internal ward and all, so always you should have a double checking. And highlight changes in medication appearance to patient upon dispensing. So if you are dispensing the medicines from some other pharmaceutical agency, sometimes you may be seeing that different color appearance. So always you should highlight the medication appearance in case if there is any difference. And the administration, read administration label carefully during the administration process and perform again triangle check, that is prescription request form, medicine and medicine label. And the triangle check is to check actual medicines against the medication labels and against the prescription. And this is the triangle check, prescription request form, medicine, medicine label. Emphasize the need to read labels rather than relying on visual recognition or location, and make readback clarification of verbal orders requirement. The staff receiving the verbal orders must repeat the orders. And the one is monitoring. So all facilities need to identify medications that look alike or sound alike in its organization. So when we are organizing the look-alike, sound-alike drugs, it should be organized in a permanent manner. And any new staff appointed in either pharmacy or ward or ICU, we have to make them oriented towards the look-alike and sound-alike drug. And the look-alike, sound-alike list needs to be reviewed and updated periodically. And if you are additionally adding any look-alike or sound-alike drugs, new procurement, anything is added, we have to always intimate all the staff in the particular hospital. And even you have to implement feedback mechanism to inform on look-alike medications. And the next one is information. All relevant personnel have access to the look-alike sound items. Either there is a old staff or a new staff, it should be a routine, mandatory practice. You should always access to the look-alike and sound-alike list. And staff are informed the new medication listed on look-alike, sound-alike in the hospital or clinic, and even you can display the information on the hospital website. And eighth is patient education, inform patients on changes in medication appearances, and educate patient and the caregivers to alert healthcare providers whenever the medication appears vary or whatever it's at the time of administering. If anything, they can intimate the pharmacy and appropriate department, and encourage the patients and the caregivers to learn the name of the medication even at the time of discharge. And if you are discharging the patient with a sound-alike or look-alike drugs, you can encourage the bystanders and the patient also how to differentiate the look-alike and sound-alike medicines. Final thing is evaluation. Evaluate medication errors related to look-alike, sound-alike medication. All the hospital we should have a policy on look-alike, sound-alike medications.